Hey guys, it's Anya here from Miami Physiotherapy and Lakelands Physiotherapy, and I wanted to talk to you today about headaches. We see a lot of headaches as physios, and we notice that there's a few questions that people continuously ask us, so I wanted to answer some of these questions for you today. Number one is, are there different types of headaches and what are they? There are different types of headaches and they can get called different things from different people, but the three main headaches are migraines, which I'm sure you've heard of before, cervicogenic headaches, and tension type headaches. Just to give you a bit of a rundown on each, cervicogenic headaches are what we refer to when the headache is directly arising from structures in your upper neck. So your top three joints of your cervical spine or your neck, they share the same nerve root as structures from inside your head. So when you're getting pain from your neck, whether it be from your discs or your joints, your brain gets confused and it can sometimes relate instead to a headache. The second one is also very common. It's a tension type headache. Similar, it can arise from structures through your lower neck, through your shoulders. Depends on where you're getting some muscle type tension. So if you're getting knotty through your shoulders or through your neck, that can relate to and give referred pain up to your head and cause a headache. The third type, the migraines, they're a bit more specific and they're not related to your muscle structures, they're related to your circulatory system in your brain and a few other things within your head that they get diagnosed from doctors, and they come with a few other side effects that I'll talk about in a minute. So the second question that I get asked is, how do you know if you're getting a headache coming from the neck or whether it is a migraine? So a cervicogenic headache won't just be associated with just the head pain. It can be, but most of the time it's you'll be getting a little bit of maybe some neck pain, some stiffness through your joints, so you might not have full movement. And similar with the tension type headaches, you might feel that you're really knotty into your shoulders, or you might find that you actually started off with neck pain and it's progressed up to your head. Migraines, on the other hand, you might be getting some nausea, maybe even some vomiting. You can be sensitive to light and a couple of other symptoms that aren't typically related to just the tension type or the cervicogenic headaches. So the third question, can physios help with headaches? The short answer of that is yes, absolutely. We do work with a lot of headaches, but it does depend where it's coming from. Migraines, typically they respond best to medications and they should be seen by a doctor, whereas the cervicogenic and the tension type headaches we can absolutely work with, because if it is coming from a pain because of stiffness or because of muscle tension, if we get rid of that tension, if we get rid of the stiffness, there goes your headache, so we can get rid of that as well. So if you are suffering any headaches and you're not sure whether it's coming from your neck or you're having a migraine, come in and see us at Miami Physiotherapy and Lakelands Physiotherapy. We can assess you, we can figure out where the headache's coming from, and then we can either treat it as needed or refer you to a doctor if we think that it's a migraine and you might need some medication. Next week I'm going to tell you a little bit about the mistakes people make when they have a headache, so stay tuned for that. But in the meantime, if you need to, book in and see us at Miami Physiotherapy and Lakelands Physiotherapy.